A cerebrovascular accident, CVA, also known as a stroke, occurs when the blood supply to the brain is interrupted or reduced, depriving the brain of oxygen and nutrients. This can cause damage to the brain tissue and lead to a range of symptoms and potentially life-threatening complications. Types of stroke. 1. Ischemic stroke occurs when a blood vessel in the brain becomes blocked, reducing blood flow to the brain. 2. Hemorrhagic stroke occurs when a blood vessel in the brain ruptures, causing bleeding into the surrounding tissue. 3. Transient ischemic attack, TIA, a temporary blockage of a blood vessel in the brain, often referred to as a mini-stroke. Causes and risk factors. 1. Atherosclerosis, the buildup of plaque in blood vessels, leading to blockages. 2. High blood pressure. Uncontrolled high blood pressure can cause blood vessels to weaken and rupture. 3. Diabetes. High blood sugar levels can damage blood vessels and increase the risk of stroke. 4. Smoking. Smoking damages blood vessels and increases the risk of stroke. 5. Family history. A family history of stroke or cardiovascular disease can increase an individual's risk. 6. Age. The risk of stroke increases with age. 7. Obesity. Excess weight can increase the risk of stroke. Symptoms. 1. Sudden weakness or numbness in the face, arm, or leg. 2. Sudden confusion or trouble speaking, difficulty understanding speech or speaking clearly. 3. Sudden trouble seeing, blurred vision, double vision, or loss of vision. 4. Sudden severe headache, a headache that is severe, sudden, and unlike any previous headache. 5. Sudden trouble walking or dizziness, difficulty walking, dizziness, or loss of balance. Diagnosis. 1. Physical examination, a thorough physical examination to assess neurological function. 2. Imaging tests, computed tomography, CT scan or magnetic resonance imaging, MRI, to visualize the brain and identify any blockages or bleeding. 3. Blood tests, to check for underlying conditions such as diabetes, high blood pressure, and high cholesterol. Treatment. 1. Emergency medical treatment. Immediate medical attention is essential to minimize damage and improve outcomes. 2. Thrombolytic therapy. Medications to dissolve blood clots and restore blood flow. 3. Anticoagulant therapy. Medications to prevent further clotting. 4. Surgery. In some cases, surgery may be necessary to remove blood clots or repair damaged blood vessels. 5. Rehabilitation. Physical, occupational, and speech therapy to regain lost functions and improve quality of life. Prevention. 1. Maintain a healthy lifestyle. Engage in regular physical activity, eat a balanced diet, and avoid smoking. 2. Manage underlying conditions. Control high blood pressure, diabetes, and high cholesterol through medication and lifestyle changes. 3. Get regular checkups. Regular health checkups can help identify and manage underlying conditions. Thank you. Like and subscribe my channel.